Good morning, everyone. Today I will be presenting my topic on paper on the topic the effectiveness of topical tacrolimus ointment 0.03% in treating refractory allergic conjunctivitis. Coming to the introduction, allergic conjunctivitis is a type 1 immediate hypersensitivity mediated by degradation of mast cells in response to IV. The routinely used eye drops containing antihistamines, mast cell stabilizer, or a combination of both are being used for treatment, and if the action is not sufficient, steroid is being added. However, steroids has some complications like secondary infections and the glaucoma, cataract when used for long durations. So tacrolimus is an alternative in treating cases refractory to routine anti-allergic medications, including steroids. It is a macro-derivative calcineurin inhibitor with anti-inflammatory and immunogenic property. It suppresses the T cell activation and interleukin 2 production. Coming to the aims and objectives, to assess the effectiveness of tacrolimus as an ointment in refractory allergic conjunctivitis. Materials and methods. This was a prospective observed study carried out in tertiary care center located in southern Assam. The duration of the study was from 6 months, from December 23 to May 24. The clearance was taken from the committee. The number of subjects that were included were 27 with refractory simple allergic conjunctivitis whose condition had not improved with traditional anti-allergic eye drops and steroids were included in the study. Coming to the inclusion criteria, male and female patients above 5 years with refractory allergic conjunctivitis. Those who have given consent for the study, and in the exclusion criteria we have included pregnancy, lactation, history of heart-beating eye disease, ocular and infections with lead abnormalities, high IOP, hypersensitive macrolides, patients without consent. Coming to the methodology, the patients were examined for visual acuity, slit lamp examination of an anterior segment, intraocular pressure was measured by government accredited chronometer, and post-assessment was examined by aptonoscopy. At the time of enrollment, the current ocular therapy was stopped. For 4 weeks, 0.03% tacrolimus ointment was administered twice daily to the affected eye. This was followed by a 2-week drug-free period. Patients were followed up in the first 4th and 7th week. Patients were given some scores as 0, 1 to 3 on the basis of severity, as none, mild, moderate, severe, respectively. Coming to the signs and symptoms, this is a scoring that has been done based on the signs, based on the intensity of the severity of the symptoms and signs. Like for photophobia, we have given 210, and for intense photophobia none. For itching also 210, and same with the same way we have given scoring for different symptoms, signs and symptoms. This is the clinical scoring based on the clinical scoring which have come out with. During the study period it was 7 to 14, and at the first week it was less than 7, at the 4th week it was less than 5, and at the 7th week it was 0. This is the bar diagram showing the total scoring at the end of various weeks during the study period at the 1st week, at 4th week, and at 7th week. And this is a scoring based on the which is in comparison with the which refers to the age and sex distributions. Coming to the results, at the end of 1st week, the signs and symptoms of simple allergic like itching, watering, and photophobia were significantly reduced. All the cases were fully cured. At the end of 4th week, all the cases were fully cured. All patients advised to discontinue 0.3% ointment. And there was a drug-free period of 2 weeks. At the end of 7th week, all patients were re-examined. None had any signs and symptoms of allergic conjunctivitis. Coming to the discussion, ocular allergy disease is a common problem affecting about 20% of the population worldwide. So, 0.03% tacrolimus ointment is found to be effective, safe, and well tolerated in the treatment of intractable allergic conjunctivitis. The most common side effects of tacrolimus ointment is transient foreign sensation, burning sensation in the affected eye, and blurring of vision, but compared to steroids, it doesn't increase IOP. Coming to the conclusion, hence from the study, it can be concluded that 0.03% tacrolimus ointment is very effective, safe, and well tolerated in treating refractory simple allergic conjunctivitis. In comparison to steroids, it doesn't increase IOP. So hence it is an excellent alternative to anti-allergic and steroid use. Moreover, the potential of 0.3% tacrolimus ointment to reduce the incidence of recurrence is desirable. These are my references. Thank you, sir.
So how long this study was followed? Because allergic conjunctivitis is very notorious for this.
Yes, we did a study for 6 months. It is
so you used tacrolimus for how long?
First, sir, we for 4 weeks, sir, twice daily it was given.
And then you stopped?
Yes.
And then again you followed after?
Then we have all the patients at the 1st week, at the 4th week, and the 7th week. So,
How do you claim that you said after one month all the patients were cured?
So based on observation, based on the signs and symptoms that have reduced, sir, but in the clinical scoring, sir.
You had mentioned that all the patients after 1 month were cured.
This was already, many patients were cured, sir.
This doesn't cure it. this will happen?
The symptoms were almost cured, sir. Symptoms were reduced almost usually.
You mentioned twice that all the patients were cured.
Did any patient develop any side effects from tacrolimus?
No, sir. Like there was a prevalence of burning sensation were there, and no other complaints other than that.
No congestion, nothing.
Sir?
No increase in congestion of the eye, no swelling.
There was hyperemia, but it has subsided, sir, afterwards.
How long did it take for the patient to account? Because tacrolimus causes irritation.
Irritation, yes, sir.
How you motivated patients to continue up despite irritation and all that?
No, we have asked the patient to continue because we have explained the patient that it will subside with time. So so we have asked the patient to continue it.
And did you add any lubricant? Because
Yes,
all
sir.
the allergic conjunctivitis
Yes, so we have added carboxymethyl
and dry eye.
carboxymethyl
You added tacrolimus plus
carboxymethyl
and nothing else.
Thank you.